Hi everyone. Today in this video, let us discuss clobetasol propionate. Clobetasol is given as an ester form propionate. So this clobetasol propionate is one of the topical corticosteroid. Among the corticosteroids, this is one of the drug which is highly potent and it is available in the different dosage forms. All these are used for topical purpose. It is available as cream. It is also available as foam and even it is available as lotion. All these formulations are used to reduce the inflammatory response when they are locally applied on the skin. Because of high potency, this drug should not be given by oral route as the systemic exposure increases the systemic side effects. Similarly, clobetasol propionate should not be given by ophthalmic route. This again increases systemic absorption as well as local effects on the eye. And again, this drug is not intended for the intravaginal use. Then what is the use of this clobetasol propionate? The main purpose of this drug is for the treatment of skin inflammatory disorders. For instance, it can be used for the management of plaque psoriasis, where the inflammation associated with psoriatic plaques can be treated by this clobetasol propionate. And for this purpose, this drug is applied around 2 weeks. And the treatment period can also be extended up to 4 weeks. Similarly, this drug can be used for the treatment of eczema as well as pruritus. So this drug reduces the swelling, itching and redness of the skin which are associated with inflammatory disorders. Today in this video, let us see how this clobetasol acts, what are the important precautions, side effects, doses, all these things we will discuss in this video. First of all, let us see the precautions of this drug. One of the important precautions of this drug is that clobetasol propionate is one of the highly potent corticosteroid. Sometimes it is also called as super highly potent. Because of this high potency, even at small dose, it can produce large systemic side effects. And even this drug can produce local skin reactions. That's why this drug should not be applied underarm. Even it should not be applied on the face as it may increase the risk of contact with the eye and systemic exposure. And it's also not applied on the groin area. So in these areas, clobetasol propionate should not be applied. Similarly, this drug is not indicated for the children. As we have seen, this drug is available as a foam as well as cream. So these two formulations should not be applied in the children less than 12 years. So those patients with age greater than 12 years, clobetasol propionate can be used. In the form of lotion, this is applied in the patients with age greater than 18 years. Because in the children, clobetasol propionate may suppress the HP axis, resulting in the systemic side effects, and it may reduce the growth of the children as well as it can produce mental retardation. That's why it is not given in the children less than 12 years. Similarly, this drug can produce some skin atrophy. It can reduce the thickness of the skin. So in those patients already having the thinning of the skin, this drug should not be applied because it can further increase the atrophy as well as it can increase the risk of systemic exposure. Another important precaution is that clobetasol propionate can produce glaucoma as well as cataracts. So the risk of glaucoma and cataracts are increased with many of the corticosteroids. Since clobetasol is a highly potent corticosteroid, it can increase further risk. That's why care should be taken to avoid the contact with eye as it increases the glaucoma and cataracts within the patients. Similarly, when this clobetasol is applied on the skin, few of the molecules can be absorbed into the deeper layers into the skin where they can be transported to systemic circulation. So once the systemic absorption is increased, this drug can suppress HP axis, hypothalamus pituitary adrenal axis. By suppression of HP axis, the cortisol is somewhat less released, which produce symptoms like Cushing's syndrome. So in such patients, we can observe increased blood glucose levels, increased heart rate, decreased bone strength, decrease in the growth rate as well as mental retardation. So all such effects can be observed with systemic exposure of clobetasol propionate. Particularly, this is observed at a dose of greater than 50 grams per week. That's why the total dose of this drug should not be greater than 50 grams per week in order to avoid the suppression of HP axis. Similarly, this drug should not be applied with the bandages or occlusive dressings, which further increase the systemic exposure. Now let us see the side effects of this drug. The important side effects of this drug are mainly local side effects. It can produce some dryness of the skin atrophy, the thinning of the skin, burning, irritation, stinging, and it can also produce some widening of the blood vessels, which can be clearly observed on the skin. Even it can produce contact dermatitis. Now let us see how this drug acts. Clobetasol propionate can act on the glucocorticoid receptors present on the cytoplasm. So once this drug binds to the glucocorticoid receptors, they can be internalized, where it can be dimerized to produce gene transcription. Now this gene transcription produces the mRNA, which can be proceeded to protein synthesis to produce various proteins such as lipocortin-1 and annexin A1. So these mediators can produce anti-inflammatory cascade, which reduce the inflammation. Similarly, if you have the inflammatory mediators can act on their corresponding receptors, which activates the NF-κB pathway, nuclear factor kappa B pathway. This nuclear factor kappa B can interact with the DNA, where it produces gene transcription, resulting in the release of various inflammatory mediators. So this produces inflammation, which is again controlled by clobetasol propionate. Now this clobetasol propionate can interact with the DNA, where it can inhibit the activity of NF-κB pathway. So this reduces the release of inflammatory mediators. By all of these actions, clobetasol propionate can reduce the inflammation. It can also increase the activity of annexin A1, which inhibits the activation of COX pathway. Now let us see the chemical nature of this drug. So this is the structure of clobetasol propionate. We can clearly observe it is having the Prigna 1,4-diene nucleus with 2 ketone groups. So we can write the suffix as Prigna 1,4-diene 320-dione. Here we can observe the 2 hydroxyl groups. One hydroxyl group is free. So we can write this as 11-beta-17-dihydroxy. But at the 17th position it forms an ester with propionic acid. So we can write the suffix as propionate. And finally we can identify further side chains. 21st position chlorine group is present, so 21-chloro. 9th position fluorine group is present, so 9-fluoro. And 16th position methyl group is present, so 16-beta-methyl. That is the complete name of clobetasol propionate. How it is given? This drug is available as cream, foam, as well as lotion. All these are available at a strength of 0.05%. So clobetasol propionate should be applied 2 times a day, and the total dose per week should be less than 50 grams. In the treatment of psoriasis, the treatment should be continued up to 2 weeks. Even after 2 weeks, inflammation is not reduced, then it can be further continued up to 4 weeks. Beyond the 4 weeks, it is not recommended, as it increases the risk of suppression of HP axis. So that's about this drug clobetasol propionate, which is a topical glucocorticoid, which is a highly potent corticosteroid, which should be applied at low dose in order to reduce the systemic exposure. But this drug should not be applied on the face, underarm, groin areas, and it should not contact with the eye to reduce the risk of glaucoma and cataracts. Even it is not recommended in the children aged greater than 12 years, this drug should be used. Local side effects are the important precautions that should be maintained with this clobetasol propionate, and it can produce some dryness of the skin, burning sensation, and it can also produce some atrophy of the skin, which reduce the skin thickness. All these side effects should be considered during the treatment of clobetasol propionate. So that's about this drug. That's for today. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.